I'm here today with Leanne Hassett, who is an Associate Professor at the University of Sydney. And Leanne has recently been involved in the development of the physical activity guideline for people with moderate to severe traumatic brain injury. Have I got that right, Leanne?
You have the Australian Clinical Practice Guideline, yep.
That's great. Can you tell us a little bit about the guideline? What is it exactly?
Yeah, so it is a guideline to help health professionals, particularly physiotherapists, to be able to deliver and promote physical activity right along the rehab journey for people who have sustained a moderate to severe TBI.
What's the importance of having a guideline like this? What does it bring to both the people providing rehab and to the people who are receiving the rehab?
Yeah. Well, for people after a TBI, getting back to physical activity is really tough. And often when a TBI happens for someone, it's, in their prime of their life. And so it's a real challenge. And so we see in this group that they're quite often very physically inactive after they've had their injury for many years. And there's lots of reasons for that. And we know from lots of evidence that there are so many benefits of physical activity, from health, social, economic benefits, and we also know that there's really devastating consequences for physical inactivity. And so there was nothing really to guide health professionals as to how to really support people with TBI, how to get back into physical activity. And so by providing a guideline, what we've done is being able to kind of show how it can happen right across that continuum of care. So first of all, thinking about aerobic training, strength training, mobility training, then getting them back to sport and rec if that's what they want to do, and that overall promotion of physical activity. So at the moment, it's inconsistent what people receive across rehab, and by having a guideline that helps to support consistent care.
This applies to people after rehab as well. These guidelines will be applicable throughout the rest of their life.
Yeah, well, for many people, they feel like rehab is ongoing for them and that their physical activity is work for them to improve and to maintain their function as well. So rehab, if you're just sort of thinking about that sort of initial inpatient, outpatient, for someone after a TBI, it's for many years.
What should physios know about the guideline?
Well, know that they exist as a starting point. They're to know what's involved in them. So there's 10 recommendations. I think importantly that they include people with TBI across the lifespan. So starting from 5 years and up. Okay. So they can be, we've got recommendations applicable for children, adolescents, and also for adults and older adults. I think it's important to know how they've been developed. So we did follow a really rigorous process for guideline development. They're NHMRC approved. Because we did follow those rigorous processes that you have to do. And they also have been informed a lot by people with TBI as well. So I think clinicians can be assured that we've used the best evidence that's available, but also really thought a lot about how applicable it is here in Australia and to meet the needs of people with TBI.
Okay. What's the next step?
Well, the next step is to implement them, because you can create a guideline, but that doesn't put them into practice. And so we've been really fortunate to get further funding from the Medical Research Future Fund. And it's a 5-year grant to support implementing them across Australia. So we're busily preparing, but next year we will actually start running a trial across Australia where we'll randomise 20 sites across Australia to either receive some support to help them to get the guidelines into practice, to get that immediately, or they'll get it delayed. And so we're hoping that extra support we provide will help to get the guideline recommendations into practice.
Okay, that sounds great. Thank you very much.
Thank you.